Hello, everyone, and welcome to today's web seminar, Centricity EDI Services Customer Update. I'm Michael Rose, Product Marketing Manager for Centricity EDI Services. Before we begin, I have a few housekeeping items that I'd like to go over. If you've attended other marketing-sponsored events, you'll notice that we're using a brand new platform for our web seminars, and I want to take a couple minutes just to go through and help orient you to navigating. At the center of the screen, you can see an area for the slides, and you should be able to see our disclaimer now. Each of these widgets or windows can be moved around or resized. So in the example, if you want the slide view to be larger, you can just drag it to make it as large as you want it to. Some helpful tips: the webinar is being streamed through your computer speakers, so there's no dial-in number. You obviously have to make sure that your computer speakers or headphones are turned on and the volume is set to an audible level so that you can hear the presenters. Webinars tend to be bandwidth intensive, so closing any unnecessary browser tabs will help conserve your bandwidth and prevent issues. Also, a hardwired internet connection is recommended over a wireless. If you're not seeing the slides advance, please refresh the web page by hitting F5 on your keyboard or Command-R for Mac users. There are a couple other windows that I want to call your attention to. First, because we will not be doing live Q&A, there is a Q&A window over on the left-hand side. Feel free to type in your question at any point during our seminar, and we'll have time at the end of the seminar to answer your questions. We also have the list of speakers, so speaker bios are available to you. If you'd like to contact one of them, you can simply click on the email icon to send an email, for example, to Kim Bruce. Lastly, on the screen is an important area over on the right-hand side that it contains GE Healthcare digital resources. So in this example, we have the EDI Services product description if you want to download that to review. And I also have the PDF of the slides from today's presentation so that you can download as well. At the bottom of the screen, there are a number of icons. If you have any questions technical related, you can hit the help button, or you can send a question to our moderator. One other important area that I want to point out, the teal icon over on the right-hand side is a survey. And I would be grateful if you could take this survey either at some point during the presentation or when we end the presentation, the survey will pop up automatically. And this will help us to make sure that we are providing the best service to you. And we also will ask for any ideas for additional webinars. So I'd like to, before we start the presentation, I'd like to introduce Vicki Wheatley, our EDI Services COE leader, and for some opening remarks.
Thank you, Michael. Hello, and welcome everybody to today's EDI webinar. We've got great information-filled agenda for you today, and it's my pleasure to introduce the topics and the speakers. Before I do that, I want to introduce myself. My name is Vicki Wheatley, and I joined GE about a year ago as the leader of the EDI Services Center of Excellence. I have over 30 years of experience in healthcare IT, working for hospitals and software companies before I came here. And I'm delighted to be a member of the team that's providing your EDI solutions. So let's take a quick look at the agenda for today. First, Arun Malik, the EDI Product Manager, and Liz Satterfield, the Senior Product Director for Payer Connectivity Solutions, will share the EDI product roadmap that was shared at Centricity Live in May. Arun is new to GE, and Liz is a longtime GE employee who moved into this new role earlier this year. I'm sure they'll provide a little bit more of an introduction, and as Michael said, there's a bio section that you have access to. Following the roadmap presentation, Kim Bruce, EDI Business Development Manager and longtime member of the EDI Services team, will provide an update on our standalone EDI solutions, also known as Project Edison. Then she'll wrap up the meeting with a review of our upcoming virtual user group meeting and our summer webinar series. So now I'll turn it over to Arun and Liz for the roadmap review.
Hey, Vicki, thank you very much. Arun and I are really excited to be a part of the EDI team. We both joined in January. As Vicki mentioned, I've been with this business for quite some time, over 23 years of healthcare IT experience, over 20 of which was with IDX/GE. So really excited to be a part of this EDI organization, and super excited to bring Arun Malik into the organization externally. He joins us from a software vendor side on the payer healthcare insurance side of the arena, which brings us great intelligence. And we're really excited to walk those of you through that were not able to join us at Centricity Live, what our product roadmap is, why we're driving in the direction that we are, and obviously answer any questions through the Q&A chat as to what we're doing and whatnot, and then hand it over to Kim to kind of round out from a services perspective. So with that, let's kind of jump into the next slide, Arun. You know, I don't think I need to tell anyone that our market is changing very quickly under our feet, whether on a personal level, as a consumer of the healthcare system, or on a professional level, whether it's on a software vendor side, obviously in the provider arena, managing your billing departments, managing your clinics, hospitals, et cetera. This is a very disruptive time to our organization in our industry. And, you know, we're really trying to get our arms around that disruption and make sure that we are providing the right solutions that drive the outcomes that you need in this time of uncertainty. You know, as we kind of look at the landscape of what's happening, regardless of what happens with healthcare reform, what we believe to be true and what all the data is telling us is that the trends that we are seeing will not change, regardless of what comes with the Affordable Care Act and moving forward if there's any legislative changes to that. We're still seeing the same trends that we predict will be trends of the future. Patients are paying more out of their pocket than ever before. High deductible plans, higher out-of-pocket maximums. The money that you're receiving is coming more from the patient than historically as a result of that trend. And with that comes a need and a challenge for you to find more efficient ways to collect that money, to increase the revenue in your pocket so that you're not losing that money, and obviously less effort around productivity to get that in your door, as well as how do we get it in sooner to lower those AR days. So those are top of mind as we think about this roadmap and what we can do to help solve those outcomes and those needs that your organization needs. Really, at the end of the day, to also improve the patient experience, because we also recognize that healthcare is very much becoming an industry of choice, and you need to position yourselves against your competitors in your regional areas, and that end consumer and that patient experience is a big part of that. So, you know, as we look at that, and part of what Arun will talk about as we get into the roadmap slide. And what we're going to show you is a slightly altered version of what we shared at Centricity Live, altered because of the feedback we received from our customers that were able to join us there. And one thing I want to ask of you guys is, you know, keep the dialogue going. If we are not solving the right problems, if we are not working on the right things, we need to hear that and continue to keep that open dialogue with us. And with that, I'll hand it over to Arun, and we can move into some of the details of our product roadmap and some of the timing of when we can get those offerings to you. So with that, Arun?
Hey, thanks, Liz. Good morning and good afternoon, folks. My name is Arun Malik, and I'm the new product manager for EDI. In my prior life, I worked on EDI transactions and automations for B2B products, mainly around claim adjudication, population health, care management, utilization management, and provider portals. I won't spend too much time introducing myself in the interest of time, and I'll just dive into the roadmap. So as Liz pointed out, this is the altered version of the slide which we used at C-Live. And we bumped up priorities for a few of these feature functionalities based on the feedback we got from the customers during C-Live. And the inception of our roadmap and vision is to reduce revenue cycle leakages for our customers. And we ensure that we address each of the following items. That is the provider financial health, the payer connectivity, and the patient experience, which are basically the three pillars on which our product stands today. And the first revenue cycle leakage that we are addressing in our roadmap is your low front-end collections. As you know, a little more than a decade ago, patient payments constituted only about 10% of providers' revenue. Now, a decade later, this has increased by 50%, which is 15% of a provider's revenue now comes directly from patients. And this trend is expected to continue with changing reimbursement models and high deductible health plans in the market. And we know a patient's habit to pay the credit card bills vary from paying the medical bills. And statistics show that the healthcare consumers pay more than twice as slowly as a commercial payer. So our goal is to turn every patient touch point into an opportunity to educate patients about their financial options. So as you look at our roadmap, we have propensity to pay, the patient responsibility estimator, and patient payments, which we are actively working on. And the second revenue cycle leakage that we are trying to address in our roadmap is the increased denials. And we know payers often change their coding rules with little or no notice. And this practice is nothing new to the folks who has worked with payers in the past. And like anyone else, payers also make mistakes and they deny claims in error. And the key to reduce denials is to prevent denials even before they occur. So in order to ensure we reduce denials, we're built in the claim scrubber, the institutional claim scrubber. Historically, we have had the professional claim scrubber, which we have sold to our customers. Now we have the institutional claim scrubber functionality, and we've gone live for our CPS customers, and we are building it for the CB and GM customers as we talk. And we have auto adjudication. We'll be building in auto adjudication capability. We want to bring in authorization information right at the start of the process so we can reduce denials due to missing auth information, and also attachment service to allow you to send all the required information along with the claims that you submit to your payers. And the other pain point we are addressing in the roadmap is to handle your large and small accounts. We want to ensure your collection efforts are routed in the right direction. Knowing the cost to collect and where high dollar and low collectible accounts are, including write-offs, is very essential for our providers to make sure they're spending the right dollars on the collection effort. So in order to address this, we have propensity to pay, the advanced propensity to pay coupled with patient payment portals solution, which we are working on. With that said, if you look at the three vertical columns, we have value coming soon, which we are actively working on right now as we talk. We have gone live with the institutional claim scrubber for the CPS folks, and we are building the capability and the plugins for the CB and GM folks. Payment reconciliation, I'll talk in detail later during this webinar. This is work in progress, and this will be ready by September 2017. Order CSI, again, this is a functionality which we released in Q1 this year. We'll talk in detail. We are diligently pursuing few partners for the patient responsibility estimator and the patient payments and authorization solutions to incorporate these bells and whistles into workflows to improve your revenue cycle performance. And we are actively working. If you folks were part of the C-Live sessions, we did talk about the new UX change, which we are working on, the improved dashboards, the improved UI and workflows, and improved reports. And everything under value on the horizon and better future are what is prioritized right after we get through the list in column 1. If you have any questions, we can discuss further during Q&A. Also, if you feel we have missed out any pressing concerns or functionalities that you're looking for on our roadmap, please do let us know at the end of this session. So I quickly want to update two features that we have built into the EDI product. The first one is AutoCSI. We went live with AutoCSI in Q1, and payment reconciliation, which is the second feature we'll be releasing later this year in September 2017. So currently, there are a good chunk of claims which are aging in your claims bucket, which requires end user to manually validate the claim status. And to avoid the manual effort to track the claim status, we have the AutoCSI feature built into our EDI product. As you know, today, your billing teams, they submit the claims, the claim gets accepted by the payer, you get the acknowledgement, but claims do not have a valid status in there. So the AutoCSI acts on the missing or late payments identified by the APT algorithm, that's the Advanced Payment Tracking algorithm. And the claim status inquiries are automatically generated for claims that are late or likely missing. And for these late claims, claim status, responses are seamlessly routed directly into your native rev cycle workflows and task engines. And the two main requirements to implement AutoCSI is the provider should have electronic Remit connections with the payers, and you should have subscribed to our task management module as the info feed from our EDI services website into the PM system to be worked on. So to learn more, please reach out to our services and business development team for a demo of this functionality. The next feature which we are going live with later this year is payment reconciliation. Our customers today, they take the payer deposit information they get from the bank and post the deposit information directly to the GL, the General Ledger Accounting Systems. And these payments from payers which is posted to the GL should balance to the ERA amounts that are posted to the RCM system, but they don't always. So Remit checks can be left on the system and unposted. They may have had system restore or outage and ERAs were not reposted. There can be various reasons why the ERAs didn't find its way to the RCM system. And in speaking with our customers, this is a big pain point and something that causes a lot of variation and frustration throughout the organization when posted dollars don't match deposited dollars. So as you see in the slide, the whole pie signifies deposits from payer posted to General Ledger, and all the AR posting received in RCM through your ERA. But the final piece, when you reconcile, there is always a missing piece of the pie. That's where we have built in the electronic payment reconciliation. So the basic design element for payment reconciliation is that the Remit programs on our GE rev cycle systems would capture the key ERA and EFT data and content in the Remit posting, and this will generate a payment record that would be placed on the RCM system and which will be swept by EDI into the payment reconciliation system to match your deposit on file. An ancillary bonus to doing this is we would be also capturing the posted and rejected amounts from the Remit posting, and we could deliver stats on actually posting efficiency, which is not available via any reports today. And to learn more about this feature, and if you are interested in being our early adopters, please reach out to Kimberly Bruce for the demo, and we'll have this capability by end of September, and we can go live with this. So the EDI of the future. As we work through our roadmap, we want to ensure our customers can manage all aspects of the process within the GE ecosystem And we want to put our customers in the driver's seat, having access to data at all steps in the process and make informed decisions. We want to continue to work on improving the provider efficiency by improving the performance of your revenue cycle, your financial health, reduce expenses for you folks by increasing automation and reducing manual work, and identify all hidden costs within the process and help you to work around those and build effective reporting and follow-up tools and make the process efficient as we move ahead. So this is the EDI of the future that we envision. And all the features that you see in gray on the top are the features that are currently available, which our customers are actively using. Everything in blue below is what we are actively working on and will be available for our customers going forward. And we want to capture the entire spectrum of the claims life cycle, starting from pre-visit, going into reg and sched, rendering the service for our patients, billing the claims, and collecting the revenue back from them. So instead of you folks investing in multiple solutions and partnering with various vendors for solutions at different steps in the process, we want you folks to have a patient-centric view and line of sight in each step of the entire cycle. We want to deliver a one-stop shop product which offers all solutions what you're looking for. And EDI being the gateway between providers and payers, we want to uplift these connections to improve process efficiencies and introduce automation where possible and have line of sight into work you folks are doing today. We are mindful and we care about your financial health. We are introducing new capabilities that will drive financial transparency earlier into the process, enabling the providers to take corrective action earlier and reduce denials and collections. And we want to enhance analytics to include leadership in additional operational roles. Our goal is to transform the culture and improve the overall patient experience by adopting refined process at each step in the claims life cycle. And folks, this is the beginning of a new relationship with you folks, and I'm looking forward to it. And as we walk together in this, we'll build products to evolve and address all the challenges that you have. If you have any questions, we are looking for it at the end of this webinar. And Kim, handing over to you, all yours.
Thanks, Arun. Hi, everybody. So this is Kim Bruce. As Vicki mentioned, I am one of the business development managers within our Centricity EDI services team. I work with a lot of customers on various things, various types of projects, but typically what we're trying to do is to help customers better utilize the solutions and help us better develop solutions for the customers. So the one thing I want to talk about today, or the first thing that I want to talk about today, is something that we call Project Edison. So Project Edison is an internal project name for our solution, our Centricity EDI services solution that works across multiple practice management systems. Basically, it's an agnostic version of Centricity EDI services. So historically, EDI services works with our Centricity practice management systems, PS, GM, Centricity Business, and that is still the core of our business. But what we've found over the years is that as customers begin to acquire other customers or they create partnerships and mergers, we wanted to be able to supply our services across whatever their practice management needs were. So about 2 years ago, we really started to dig into how do we make this happen, and we had to do some development work. We worked with a handful of early adopter customers to really make sure we had everything worked out and the processes and all of that. But we're at the point now that we're really starting to talk a lot more about this. So Project Edison, it enables Centricity EDI services to connect to third-party practice management. It removes the complexity of managing multiple EDI solutions. One of the things that we noticed is with our customers as they were doing their mergers and their acquisitions and their partnerships, the ability to manage multiple EDI vendors became increasingly more complex. The other piece that was, a challenge for a number of these customers was, a comparison of apples to apples, right? So how we are tracking our front-end rejections may not be the same way another vendor was tracking their front-end rejections. So customers didn't have a really good, solid view across their organization of equal items. Excuse me. So that's where, here it says provides consistency across all the practices in the organization. That's really where that comes into play, is to be able to provide a consistent view regardless if you have 3 different practice management systems in the background. Hold on. Here we go. Sorry, I'm a little slow on the slide. So here are some recent projects that we worked with. OrthoArizona, they were a customer that I believe they had 3 different practice management systems that were kind of running in the background. And they were still unsure of what was going to be their actual practice management system. They were fully functional, fully merged. But they did know they had challenges because of shared tax IDs and NPIs, and it just made a lot of sense for Centricity EDI services to be able to provide them services across their different practice management systems. Sublette County was another one of our customers that was originally a CPS customer, and they moved to Epic, to the Epic practice management system. However, they wanted to stay on Centricity EDI services. They did not want to have to change their EDI vendor. So we were able to work with them and move their services over to offer integration back into the Epic practice management system. OrthoArizona was another one of our customers that I will actually get into a little bit more detail on, and a few other customers as well. So here's some of the practice management systems that we've worked with. It's not limited to these, but this is just a sampling for you all to get a sense of who we've been working with and how that all plays out. So OrthoArizona, I wanted to highlight them because they had a really unique situation. So they had 21 different divisions, and they had probably 9 or 10 separate practice management systems. They knew that they were going to eventually move all of their divisions into CPS, but they had some pretty immediate EDI services needs. So we did implement Centricity EDI services for them for CPS and a number of their divisions and their separate practice management systems, and then they had everything on a single EDI services website. We did a number of things with regards to remit splitting and routing, and we had to get a little creative and a little crazy, but in the long run, I think it was the right thing for them. It helped them move to a single platform while they still had all of their practice management conversion work going on. So it was a challenging project. We also did payment automation for them, which was something that was relatively new in the CPS arena. Payment automation is our tool for converting paper EOBs to an electronic 835. And we had not done it in CPS, although we've been live with it for years in GM and CB. This was our first CPS opportunity. So they were, as I said, they were fun, they were challenging. It was really an exciting project for us to be involved with. Another customer that we did an Edison type of project with was Schumacher Clinical Partners. So Schumacher was a long-time Centricity business customer. They're an emergency medicine billing organization, and they're big. They're a big organization. They also went through an acquisition and merger mode, and they had 3 or 4 different practice management systems with these mergers and these acquisitions. And each one of these, separate merger and acquisitions had their own challenges. But the one common theme was that the billing and the tax IDs were not changing. So for anything that was being transitioned, that same tax ID and billing NPIs were being implemented in the Centricity business system. So we had to do a lot of remit splitting. So when the remits would come back, we had to basically look at the claim level to say, okay, does this belong in the CPU system? Does it belong in the AthenaNet system? Where does it belong? So that was really a challenge for them, and they wanted to be able to maintain a high level of productivity. So not having these files as electronic really just was not going to be an option for them. So one of the things that we worked with was to create a new report called the Remit Reconciliation Report. And we actually used this report at OrthoArizona as well. They were our actual originators. We originally developed this report to help with the splitting of remits for OrthoArizona, and then we were able to reuse it for our Schumacher project as well and some other customer projects. But what this Remit Reconciliation Report does is it shows us when we are having to split a check and send it to 2 different places or 2 or 3 different practice management systems, we needed a way to show where it went, and we needed a way to still maintain what the actual full payment amount was, right? So we would have a check that could split 2 or 3, 4 different ways, but I still needed to be able to say, okay, well, I have this check 1, 2, 3, 4, 5. What was the total paid amount on it? Because when you're doing your reconciliation with your bank deposit, you need to know what the full amount was, but then you also need to know to see how that money was split apart. So we created a new report called the Remit Reconciliation Report. It's really useful in situations where we're doing this type of splitting, right? I think if you're a customer and you're not doing this type of splitting, there's not a lot of value to the report to you. But if we are doing advanced remit splitting, it's a really valuable report. And if you have questions on it or think it might work for you and your organization, please feel free to reach out to me. But here, basically, if I had my report and I click on my check number, it will show me the full amount, right? So I'm always keeping track of what that full check amount was. So even though this check split twice, when I click on that check number, I still maintain what that full check amount was. So this was something that was actually a little bit of a precursor to some of the work that we're doing with the payment reconciliation that Arun mentioned. But again, if you're an organization that is doing splitting and you think that this report may help you, please feel free to give me a shout. So in terms of what does this really mean to you from a Centricity EDI services standpoint, the first thing that I want to make sure our customers are aware of is that we are an agnostic solution. So we can work across the board with many, many different practice management systems. There's a couple of practice management systems where the EDI is sort of so embedded it doesn't, they can't actually separate it out. I think Cerner is one of those organizations. But for most of the practice management systems out there, we have the ability to work with them. We continue to focus on your needs. So again, we're really looking at how do we continue to provide services that meet your changing organizational needs. And I think that this was one of those areas that we really had to spend some time focusing on. We like to call out our data center, but our data center is really stronger than ever. We've been making just huge investments into everything that we're doing from a data center standpoint. And then finally, the consolidation of all of your EDI transactions onto a single platform can help to simplify your operations and hopefully in the long run be saving you money. So just a few of the benefits of using Centricity EDI services as your organizational clearinghouse, single portal access, as I mentioned, some of the advanced remit splitting functionality and capabilities that we have, the ability to split a check down to the actual claim level, ability to see across all lines of business with drill down capabilities or secure end user level of access. Consolidation of performance reporting with cross-organizational view, but also, again, some of that drill down or filtering capabilities, and reconciliation reporting for your remit splitting. So these are just some of the benefits of using Centricity EDI services across your organizations, not just for your Centricity practice management systems. If you have questions, if you are thinking that this might be something that would work for your organization, please feel free to reach out to me after the call, and we can set up some time and talk and see if this is going to be an opportunity for you. With that being said, I'm going to pause there, and we're going to switch topics a little bit. So again, anything that is practice management agnostic, Centricity EDI services, if you have questions, whether or not that is an opportunity for you, please don't hesitate to reach out to me. I believe Michael has shared our contact information. So we have some fun things coming up. We have a virtual user group meeting, and we have some summer webinar series. So I think most of you are aware that we try to do regional user group meetings across the U.S. at different points throughout the year. It's always a challenge to find the right location, that we're getting, the right number of customers involved, but it's something that we're still committed to doing. But what we thought we would do in September is to do a virtual user group meeting. So on September 19th, from 2 p.m. to 4 p.m. Eastern, we will have a virtual user group meeting. Hopefully, we will have lots of customers attending and participating. We're working on the agenda now. Hopefully, we will have that wrapped up and ready to go within the next couple of weeks, and we will send that out to all of you, as well as getting the save the date to your calendars. So we're very excited about that. Some of our other webinar series, our summer webinar series, and I have to make my screen bigger because there's a lot going on here. So this is for just in general Centricity EDI services webinar. We have some dates coming up with regards to just, helping customers understand what our service offerings are. So if you know of customers, if you have other colleagues out there that maybe want to learn a little bit more about what Centricity EDI services does, we'll have a webinar series focused on that. We also have a hosted claims manager webinar series coming up as well. So for customers who aren't aware of what our hosted claims manager services offer, or what they can bring to their organization, the benefits they can bring, this is a great series to attend. And Michael, just real quickly, have we already sent out the save the dates on these?
Those, I believe Nancy is coordinating.
Okay.
And I think that they're just advertised on the services portal.
Okay. Okay.
But we will follow up on that.
Yeah, we'll double check that. So I'll just go back to this real quickly. So if there are questions, if you are interested in these items, we'll make sure to let you know where the details will be. I know it's on the services portal. I don't know if there's actual invites being sent out as well, but we'll double check that. Hopefully you can plan to attend. Again, the virtual user group meeting is in September. If you have ideas of things you'd like for us to cover maybe as part of that virtual user group meeting, please let us know. As always, your feedback is important to us. And then I think our final slide, might be the final slide, is our class ask. So again, we take our survey results with class very seriously. They're very important to us. We like to see how we are ranking. We like to hear the feedback from the customers. So if you have a couple of minutes, please go online, fill out the survey. I promise it's not too difficult. It's not too hard. But we really look forward to hearing from you and your feedback. And I think with that, we're opening it up for questions, right, Michael?
Absolutely, absolutely. Thank you, Kim, and thank you, Arun, Liz, and Vicki as well. So we have a couple questions that came in through chat. The first one is, will this presentation be recorded? And absolutely, I neglected to mention that in the beginning, but we record all of our presentations, and you should be receiving an email with a link to the recording within the next 2 to 3 days. We also put the recordings in the services portal. So if you want to jump into the services portal, the EDI site, you can get the recording from that as well. Next question. This goes back to, I think, Arun. You were talking about reports and dashboards. So the question is, what reports and dashboards are currently available? And that may be
thanks, Michael.
Yep.
So, folks, we are currently redesigning the primary and secondary navigation and interaction behavior of our EDI website, the customer web portal, and we are working on surfacing information that is more relevant to the role and improve your experience, your UX experience. And we have more graphical and actionable dashboards in the new UI. And we have customer review sessions which will be starting soon. And we would love to engage you folks for our new UI customer review sessions and get your feedback to incorporate that before we go live. And with reports, the one new report is the payment reconciliation report, which I spoke about during the webinar. In addition to that, we have made reporting simple, and we have reduced the number of clicks to drill down and have relevant information displayed for you folks. And this is work under progress, the reporting features, and any net new reports that we'll be building into will basically publish that as we build it. If you have any further questions, you folks are more than welcome to join our customer review sessions, and we'll send in the schedule for those shortly to all the folks here.
Great. Thank you, Arun. Okay. Okay, so there was a question about the virtual user group. Kim, you already answered that. The agenda should be coming out in the next couple of weeks, so that was good. I have a couple questions on our ability to integrate to other practice management systems. So the first question is, we have a practice that uses Kronos. Can you integrate with that? I think, Kim, that's for you.
That's a good question. So we are we're actually exploring Kronos right now with one of our customers as a potential project. So far, it looks like we should be able to seamlessly integrate back to their practice management system. We're waiting to find out a little bit more information, such as whether or not that system could read in the 277CA report that would bring the front-end rejection messages back into their PM system. But as of right now, it does look like it will be, at least from a claims and remit standpoint, that the functionality would flow okay.
Perfect. Another question was, how do I learn more about the ability to integrate to other practice management systems? And I'll just say in the speaker bio area, you can click on Kim's email icon and send her an email to connect directly with her. Also wanted to point out, if you have a question for Arun, you can do the same thing. Myself, if you're interested in any questions about future marketing programs, Liz and Vicki also have their contact information there. Let me look, just make sure that we don't have any other questions. Okay, so there was a question about becoming an early adopter, and the person is interested in being an early adopter for authorizations. I want to reiterate that again, Kim is the point of contact, so if you are interested in becoming an early adopter, helping us shape the future of that particular product, send Kim an email, and she and Arun will work together to get you involved. One last thing I want to ask as a request. At the bottom, again, at the bottom of your screen, there is a teal-colored icon with the survey. Please take a couple minutes and complete the survey. We really want to know how you rate your experience with this new presentation tool. We are also interested in understanding what other topics you have for future webinars. And Arun asked me to have a question in there for some information on how you prefer Arun and team to communicate back to you. An example might be regular emails, it could be a webinar, it could be a virtual conference, it could be on-site. So once we conclude this webinar, the survey will pop up. I'd be grateful if you took a few minutes to complete that survey. So one more chance. Oh, there is another question.
Oh, there's one more question.
Yes.
I just saw
okay.
Christina Randall posted, and I can probably answer this question. So
okay,
Christina was asking if about the reconciliation of ERA with the bank deposits. This is actually a solution, Christina, that would apply across all of our Centricity practice management systems. So it's CPS, GM, and CB. There's some added benefits with group management in terms of being able to auto-post remits that we're looking at how we tie that back into the bank reconciliation. So if you're interested in seeing more about that solution that we're working on, please feel free to give me a call or send me an email, and we can set up some time, and I can walk you through. I've got like a small WebEx that I could walk you through, and we can talk about the different points of integration that we'll have.
Great. Thank you for that, Kim. All right. I'd like to ask Liz Satterfield to wrap up the webinar with some closing remarks.
Hey, thanks, Michael. So, for those of you that joined this, hopefully you got something out of it. You can see where we're going. My one ask again is let's keep this dialogue going. Our EDI business is obviously very important, not only to us as the value-based care business, but also we believe to you guys as our customers. And we want to make sure we're making the right changes to evolve with the industry. All clearinghouses are shifting beyond traditional clearinghouse transactions, getting more involved in moving some solutions upstream. As you can see from our roadmap, that's exactly where we're headed. And we don't want to do this alone. The voice of the customer and understanding the challenges that you guys are facing and making sure that we're developing and prioritizing the right work is a key component of our success jointly. And we want to make sure that we're on that journey together. So again, I can't emphasize, please reach out to Kim, get involved in these dialogues if you're passionate about one of these topics, be a part of helping us shape the right solutions going forward to solve your business problems. And just know that we've got the commitment to be there side by side helping you do that. And thank you very much for joining us today. We really appreciate the opportunity to talk to you about where we're headed with these solutions.